This map is the beginning of our story. It about looking at numbers, hearing about how people have been fighting this sickness and celebrating the win along the way. Me, myself, Shubhendra, Balvindra, and Nachiket has this opportunity to invite you us to join us. Let's delve into what these number and story reveals about one of the most significant health battle we have faced. Our story start with a spatial map. This isn't a map of a new place to visit. It's the map that shows how the sickness has traveled everywhere to all kind of countries, big and small. By the time it was March 25, the sickness has reached 183 countries. That's a lot of place. But this map isn't just showing us where the sickness is. It also showing how strong people are working together to get through hard time. Moving to the next part of our story, let's talk about a big help we got from John Hopkinson University. They made a special dashboard that shared updates about the virus as it happened. This was a super useful because it gave us information we needed right away to make good decisions. But there was a catch. The simple number on the dashboard weren't enough to tell us everything. Every country is different. How many people live there, how good their hospitals are, how many people they can test for sickness. All these things change the numbers. We figured out that to really understand things, we had to consider these differences. That's like making sure we are all using the same ruler to measure something. But doing this, what grows up called normalizing the data. We could really see how each country was doing.
We started with a big dashboard from Johns Hopkins University showing total COVID 19 cases, death, and vaccinations worldwide. But it only gave us raw numbers, not accounting for countries' population. This made comparing countries difficult. To make things clearer, we came up with our own dashboard. This one is a bit different. It does not just count every case of the virus, it thinks about how many people live in each country. This way of looking at the numbers is like making sure we are all playing the same game with the same rules. When we only looked at the big numbers from Johns Hopkins, it seemed like America was having the biggest problem with the virus. But on our new dashboard, where we adjusted the number for the population, we saw that America was more in the middle. It was not the worst, but it was also not the best. This new view helped us to see that things were not as simple as they first looked. And to make this even easier to see these comparisons, we added some cool features to our dashboard. We used color schemes for different countries and we put in tools like highlight and filter actions. This way we can quickly find and focus on the information we are interested in, especially when we want to see how US compares with other G7 countries. Clicking on a country's flag brings its data into focus, helping to understand its pandemic status in relation to its population size. Furthermore, we have included bar race plots to dynamically represent changes in cases, deaths, and vaccination over time. These tools makes our dashboard not just informative, but also really easy and fun to use. Now we are going to dive deeper into our dashboard for a closer look at how the US did compared to other G7 countries. With a focus on cases per 100k people, the US is not at the top. It's actually fifth among these countries. This shows a different story than what the total numbers alone would tell us. It gives us a new way to see how America handled the virus, showing that it's more in the middle, not the worst or the best. This middle position changes how we talk about America's response to the virus. It seems like they had some control and did some things right, which we could not see just by looking at the total numbers. The ups and downs in the graph shows us how the virus spread and how things changed when countries did different things to try and stop it. In this part of our story, we look at something really important. How many people have died from COVID 19 in each country compared to how many people live there? This helps us understand things better and clears up some wrong ideas, especially about how the United States is doing to other G7 countries. Before, it seemed like the US had the worst time with the virus because of the total number of deaths. But when we adjust the number for how many people live in each country, we see that US is actually more in the middle. The United Kingdom, on the other hand, has a higher death rate when we look at it this way. Countries like Japan and Canada did really well. They had strong rules about public health and people really followed them, which led to fewer people dying. These countries shows us that working together and following health rules can make a big difference. The graphs we have tell us how each country responded to the virus, including the first big outbreak, the times when different versions of the virus spread, and when lots of people got sick. Every part of the graph teaches us something about being ready, staying strong, and how important it is to have good health rules. In this story about the world is fighting COVID 19, we have a chapter about vaccination. It's a bit complicated. The United States gave a lot of vaccine shots, more than any other big country. But when we look at the number of shots given for every 100k people, the US is actually seventh among the G7 countries. This tells us that even though the US worked hard, there were some big challenges. Some people did not want to get the vaccine, and the way healthcare is done in different states made things a bit uneven. Even with these problems, the US did a huge job in giving out vaccines. The graph we have shows the ups and downs in giving out vaccines. It tells us about the big effort to get vaccines to people and how each step forward was a big deal because it was not easy. Telling this part of the story is important. It shows us how many people worked together to give out vaccines and how many people decided to get vaccinated for the good of everyone. It's not just about the rules, it's about people wanting to keep each other safe. Seeing where the US is on the graph reminds us there is still more work to do. We need to help people feel okay about getting vaccinated and work together in healthcare. It's like a reminder that we need to keep going and do even better as we keep fighting the virus.
So hello guys, from here I will be presenting the presentation. Till now we have compared US with other G7 countries. Now from here we are going to compare South Carolina with other southeastern states. Now in this dashboard we have used two metrics, cases and death. Now while comparing the cases, initially we took the raw data and then compare it, but it was disaster. That we were showing that the South Carolina wasn't properly handling the COVID-19 and it was having a big disaster in their state. But when we normalized the data, we were able to see that the South Carolina wasn't that much bad. Yeah, it was the second highest in southeastern states, but it wasn't that much bad. It was following the similar trend like the other states. Now, for getting more detailed information, we decided that we can compare that how much cases are there in this state depending upon their population density. But the results were different than what we considered. That the Virginia, Georgia, and North Carolina, which were highly dense areas, were having comparatively less amount of COVID cases, whereas the areas like Mississippi, Alabama, and Kentucky were a little bit less dense, but were having high COVID cases. So here we can say that the population density will not affect the COVID cases, but what significant things the state has done, like different policies about COVID-19's increase in the infrastructure in healthcare, will affect that. Now similarly, while looking at the death data, we were able to see that the South Korea was doing very much better in this area. It was at the 7th, whereas North Carolina were at the 9th. We're having the least amount of death. But when we see the CFR graph, we were able to see that the Georgia, which was on the 6th in case death per 100k graph, went at the top with 1.41% CFR rate, whereas North Carolina was at the bottom. Now here, after having a little bit research, we were able to find out that North Carolina had 90% of the population vaccinated with single dose and 67% with fully vaccinated. Here's South Carolina was not at the back. South Carolina were able to have 70% of its population vaccinated with at least one dose and 60% fully vaccinated. Here also we can see that the states which have taken good actions regarding COVID-19 were able to reduce the impact of COVID-19 on their death ratio. death ratio, whereas those who haven't done a nice job were not able to save their population from COVID-19.
Thank you so much for your time and consideration. Let's step forward with caution but also with confidence, knowing that each vaccine administered, each mask worn, and each hand washed is a step toward a safer tomorrow.